Once again, back to Boond ttalk Train of Thought with a series of an episode with Dr. Anil Bradoo exclusively on ttalk Boond. Sir, welcome back to this episode. It's a great insights of your journey as far as medicine which are concerned, also valuable insights for target audience in terms of urology and also in terms of kidney, and your story which I'm sure is a lot it will inspire million of the people who are watching ttalk show So many times if we see doctor, they right from morning till evening they are running around, and there are a lot of tasks what they have to handle and when we talk in terms of work-life balance, how you manage those stuff and being so stressful exercise, how do you manage your life
So let's put it simply. I'll give you my own experience, which is the best way I can put it up. I think as a human being, you have so many qualities in yourself, and sometimes you get bogged down by just your profession.
Mm-hmm.
So your main profession seems to take complete precedence over everything else you may want to do in life, and you don't seem to think that anything else is important in your life. Right till the age of 50, almost 50, I was also only busy practicing urology or being in urology activities or in patient care.
Mm-hmm.
And I did not really have the time or even the thought that is there anything else I think I can do which will not only make me happy, make me share my passion with others, and whether I can make other people happy in the bargain.
Mm-hmm.
So at that time, there were two important things which I would like to share with you.
Mm-hmm.
One was we were a group of specialist doctors who for some reason had come to meet each other, and we used to be at each other's homes singing songs, taking part in music.
Mm-hmm.
And either it would be at my house or his house or her house, and basically we would sing to each other.
Mm-hmm.
And about 20 people would be there in the house, and we would get some musicians, practice a little bit and perform, and then forget about it.
Mm-hmm.
So after a year and a half of doing that, I, along with another colleague of mine who's a consultant ophthalmologist, Dr. Manish Sharma, we just thought we are doing so many activities where we are in the urology society or in the ophthalmology society. We do big conferences, big workshops, big webinars, seminars, all in a proper professional way.
Mm-hmm.
Why don't we take this music also in a semi-professional way? Why don't we want to do this so that we are able to make other people happy, share it with other people,
Mm-hmm.
do it with an audience, do it in an auditorium.
Mm-hmm.
So, but I said, why should we be doing it?
Mm-hmm.
I said, we as doctors have a responsibility.
Mm-hmm.
That responsibility is also partly to share relevant awareness material about prevention and cure and treatment of certain diseases.
Mm-hmm.
And I think if we can bring it out in a very nice manner, along with giving them a good time,
Mm-hmm.
entertaining them, making them happy,
Mm-hmm.
and giving 10 to 15 minutes of only giving this information, vital information, which could be and was,
Mm-hmm.
whether it was blood donation, whether it was eye organ donation,
Mm-hmm.
whether it was for care of the hearing and speech handicapped, whether it was awareness about autism, whether about hair donation for chemotherapy patients who are on cancer therapy,
Mm-hmm.
various such causes,
Mhm.
and even for the girl child,
Mm-hmm.
even for urinary problems,
Mm-hmm.
or you could name so many problems in general in life which we could talk about.
Mm-hmm.
Kidney donation for kidney transplant, liver donation for liver transplant.
Mm-hmm.
So I thought, why not use that opportunity where you get 15 minutes of awareness with music which you can share with people, which will be done free of cost. So you do not charge anybody. You invite them to participate in the program.
Mm-hmm.
You do it free of charge for them.
Mm-hmm.
Doctors don't take a single penny, but you organize it in an auditorium
Mm-hmm.
with proper sound, proper light, proper auditorium
Mhm.
at a proper time,
Mm-hmm.
and pay the musicians because it is the daily bread and butter,
Mm-hmm.
but give people a good time.
Mm-hmm.
Therein started what we started and organized a group called the Tuning Folks.
Mm-hmm.
So the Tuning Folks is a group of specialist doctors who are all leading doctors in their field.
Mm-hmm.
And so like in urology, we have an ophthalmologist, we have another urologist, we have a pathologist, we have an ENT surgeon, a dental surgeon, gynecologist, cardiologist, cardiovascular surgeon, anesthetist, all specialty. There are one or two doctors who contribute their time and their talent. They practice on their own, come for a grand rehearsal with all the top musicians in Mumbai. And we do programs since last 10 years. In fact, 2 months ago, we had the 75th Platinum Jubilee program, which we did. And that was dedicated to Muhammad Rafi, where Rafi's daughter and son-in-law were the chief guest who came. And there we share this platform with all the audience which has been invited. We've had the fortune of having presented these programs not only in Mumbai, also in the periphery in Thane and Kalyan, but we've also been invited to Delhi twice, to Goa, to Pune, to Aurangabad, to Banaras, to Cuttack, to Bhubaneswar to do these programs. We have had the fortune of being invited to Sahyadri Doordarshan 3 times consecutively to do a 3-hour live program. It was not recorded. It's a live program we did for 3 hours, the other time for an hour and a half. For the Mumbai Doordarshan Sahyadri, it was telecast to all the channels.
I see.
This way we were able to not only contribute, and we are contributing. So this is one of the stress busters, or something which we are able to give back to people and communities. And believe me, in a single program with 1,000 auditorium, in a 15-minute message, with 3 hours of entertainment, we are able to make so many people happy. So many people become part, you become part of the community, communities become part of the medical community, and they realize that doctors are not just, working in their profession. They're not just doing their work and making money, but they're also
entertaining.
Just like a common man, just like any common citizen, taking part in common activities. So that is one aspect we have been doing, and successfully we've been doing. Even in COVID times, we had almost 17 YouTube presentations of captions of 45 minutes to an hour programs, just like you're doing your ttalk. We did what is the Tuning Folks Talks, where there is music brought about online, because there was no egress. People were not able to attend. Auditoriums were closed for 2 years. So we did online programs for them, and we were able to reach out to audience even outside our domain. So that's purely doctors doing it for awareness, doing it free of cost, and sharing their happiness with people. And that is one thing which we have been able to do. What has been promising for me, take home message for us as doctors, is that we have been able to motivate so many other doctors, not only doctors, chartered accountants, lawyers, people in their professions, to do something similar. We've had people who otherwise did not take into any other profession than their own, but who have gone into sculpture, who have gone into photography, or who have gone into writing poems and publishing them, and writing plays and doing dramas, which was not their job, not in their domain, because they also got motivated after seeing what doctors do. They felt, oh, why can't we do ourselves something? Why do we have to think that only others can do that? So that is one aspect which has been a very exciting aspect in the last 10 years. In fact, we are going to spend our 10th year with a big program at the Fine Arts Society on the 10th of December.
10th of December.
That will be celebrating 10 years of the Tuning Folks.
Okay.
Similarly, I thought that doing relevant medical camps is good to do with organizations like the Rotary. So I became a Rotarian, and I realized that certain aspects of Rotary impressed me, is that you could go out into the communities and take funding from Rotary International, as well as from your local camps and the district, and reach out to the community and give your expertise. And through that capacity, I don't need to just be a urologist. I can do common things like checking people for common ailments like blood pressure, diabetes. You see, diabetes is the number 1 disease today. And if you're able to go out in the community and tell them how to prevent diabetes, how to treat diabetes early, you will prevent the complications in the kidney because of diabetes, complications in the heart because of diabetes, complication in the peripheral vessels in your skin because of diabetes. So that I think every doctor should do. How to take care of your heart, how to take care of your blood pressure, how to take care of your diabetes. If we do community projects, talks, measurements, and prevention, and in the community tell them how these common things can be prevented. That is a very, very great thing. All of us can contribute to the community. Similarly, my contribution, because of certain international liaisons with what is called as projects done to prevent urinary incontinence, to prevent urinary tract infections, to teach circumcision in Uganda, in the African countries
Mm.
where it is a problem.
Mm.
Also gave me insight as to what the problems are in the world, not
Mm.
just in your city, not just in your state, not just in your country. You can give your expertise and your best offices to even other countries through Rotary, because that gives you a chance to contribute your expertise, those 5 days, 7 days, which you can take out from your time.
Correct.
You can integrate with people outside your country and help them, help the nurses, help the doctors, help the personnel, help their people
Great.
give out. So I think that is with Rotary we could do. So there are so many things when you become a little too busy in your practice. You know, you have so many more people joining your specialities.
Correct.
That is when your expertise can be going in other fields. Your
Correct.
passion, your love for life, you can experience with people at large through your expertise, and then you can give back to the community.
Correct.
In terms of medical camps, helping diagnostic camps, helping sharing your knowledge, and also your other aspects of your life.
Mm.
And I think one thing is that I feel everyone is so talented that we just forget that there are other talents which we have.
Other talents also you have.
Why don't you share them also? You don't have to be a professional in those. I mean, make money out of those.
Correct.
But you can
Just
give back to society
give back
through
to
those.
so many.
Yeah.
I think it's a great exclusive insight for ttalk audience. When we talk in terms of a doctor, right from morning till evening, they are trying to save our life. But I think when we talk in terms of making it more meaningful, there is certain hidden talents which are there. I'm sure the kind of initiatives which sir, you have taken in terms of entertaining and passing on the message as for the health factor which is concerned. I wish you all the best. God bless you in abundance, and I'm sure like many of them who are listening to this ttalk show will get an inspiration and they will come and contribute this towards this particular cause which is there, and I'm sure like that's how one transforms society at large. So thanks a million for being part of this ttalk show, and I'm sure there's a lot of great insights from the story of Dr. Anil Bradoo what we got only on ttalk ek Boond Soch ki. If you like this episode, just go to www.ttalk.net, subscribe and like the channel. Do catch up with Dr. Anil Bradoo in the next episode on ttalk ek Boond Soch ki. Till then, thank you very much. So thanks a lot for your time. Thank you very much.
Thank you so much.